Two health stories that are getting a lot of attention right now. Let's dig into them. First, a New Hampshire man is hospitalized with a tick-borne virus called Powassan virus. And second, health officials are working to contain an Ebola outbreak that has spread from the Democratic Republic of Congo. And as you can see, joining me right now, as usually does on Tuesdays and Fridays, Dr. Todd Ellerin, Chief of Infectious Diseases, Social Health. It's great to see you, Dr. T. So first, let's start with ticks. Most people know about Lyme disease, Lyme, Connecticut, Lyme disease, but Powassan virus, we've heard about it, but we're much less familiar with it. What is it?
Right. It's a tick-borne virus, and the good news is it's rare. The bad news is it can cause a very deadly, what we call encephalitis, which is a brain infection, where patients, can be critically ill, like this patient, critically ill. You can be on a breathing machine, you can have seizures, you can, have paralysis, muscle weakness, and so it is serious. There's about a 10% mortality. Most patients do survive,
Really?
But 50% of the survivors have neurologic deficits.
50%?
Yeah.
Wow, those are some startling numbers. That'll open your eyes. So we're heading into peak tick season all across New England. So what should people be doing right now to protect themselves?
Right. It's the same things we've been saying for years, right? Use that DEET, right? The tick repellent. That's key. Long pants, long sleeves. Tick checks help Lyme, because remember, the tick has to be attached for about 36 hours to inject the Lyme. With the Powassan, the problem is, even if the tick's attached for 15 minutes and it can be the same tick, that can, inoculate you with Powassan. So tick checks aren't as helpful there.
So how do you balance it? For example, you've got long sleeves on and you've got long pants on. When it's 95 degrees outside, you don't want to wear long sleeves and long pants.
Right. So that's when it's even more important to make sure, you spray yourself down, and, DEET will repel these ticks, just like mosquitoes. It's the same thing that mosquitoes repel the ticks.
Let's talk about the Ebola outbreak that's happening in the Democratic Republic of Congo. Of course, the World Cup is bringing many visitors from that country and others to North America because they have qualified for the tournament. So what systems are in place to contain cases before they actually do come here?
Yeah, what I do want to say is, there is not going to be an Ebola outbreak, and I'll explain why. We do have to worry more about the heat. We have to worry more about norovirus, things like that, rarely measles. But the issue with Ebola is that the sickest patients can't travel. When you're the most contagious with Ebola, you can't travel. Yeah. You're too sick. But there are travel restrictions. There is, quarantining for 21 days before coming in. There are only 4 designated airports where if someone from Uganda, for instance, comes, they have to go through the closest one to Boston would be Kennedy. Right. So and then they're checked out by the CDC. There's communication with our Department of Public Health, our state DPH. They're in close contact with them, so they're monitoring these patients as well, checking in. Our DPH has set up a statewide operations center, not just for Ebola, but for lots of different things. They're doing syndromic surveillance, enhanced wastewater. There's so many things. They're sending us alerts. So the hospitals are prepared. We're preparing for these things. So Massachusetts is doing a lot. A lot of money's been spent, a lot of time and effort.
What would have to happen before this became a concern here in Massachusetts?
The answer is there have to be such breakdown on so many levels, and the answer is there's not going to be an Ebola outbreak. Biologically, scientifically, it's not possible. Could we see a single case? Of course, that's always possible. And guess what? We also have one of the nation's biocontainment units at Mass General Hospital. They are prepared. So if we see a patient, let's say at South Shore, we're concerned about, we obviously do what we have to do, and then we would get that patient to MGH where they have a biocontainment center to treat these patients. So we're lucky. We're lucky to live in the state we do.
Dr. T, great to see you.
Good to see you.